Let's see the progression of clinical manifestations in relation to fluid loss in case of Vibrio cholerae infection. Okay. So let's see how the clinical manifestation of Vibrio cholera progress. So if the fluid loss is less than 5%, the symptom will be increased thirst. अगर 5% से कम fluid loss है, then the symptom will be increased thirst. अगर 5 से 10% का fluid loss है, then the symptoms are postural hypotension, weakness, tachycardia and decreased skin turgor. 5% से 10% का अगर fluid loss है, then the symptoms will be postural hypotension, weakness, tachycardia and decreased skin turgor. Postural hypotension, weakness, tachycardia, decreased skin turgor. If the fluid loss is more than 10%, the symptoms are renal failure due to acute tubular necrosis. Okay. If it is more than 10%, it can result in renal failure due to acute tubular necrosis. And the fluid loss of greater than 10% will result in oliguria, weak or absent pulses, shrunken eye, shrunken fontanelles in infants, wrinkled skin. Okay, wrinkled skin. First, अगर 5 से 10% है, then there will be decreased skin turgor. Greater than 10%, then you will find wrinkled or washerman skin, and you can even find somnolence and coma. So again, more than 10% loss hai, then there can be renal failure due to acute tubular necrosis. And fluid loss result in oliguria, weak or absent pulses, shrunken eye, shrunken fontanelle in infants, wrinkled or washerman skin, somnolence and coma.